This is why the targeted therapy found in your genetic testing might not be working as well as you'd hope. For starters, how thorough was your genetic testing? How large of a panel was used? If not at least 500 genes, then definitely targets are being left on the table, and you might be being treated for one particular mutation that isn't even a primary driver of your cancer. That can be one reason. 2, did your doctor do any additional research on your test results at all? Or did they just use the computerized paper that came from the testing facility? In which case, no personalized research really was done. Any extra detail that might be present in the report, and usually there's tons, is not being applied to your case. And a lot of times those extra little bits of detail are the answer to why my targeted therapy isn't working. And that brings me to part C, which is oftentimes, if a targeted therapy that is identified for you through genetic testing is not producing great benefit, it's because you have other mutations that are getting in the way of that drug working. These are called desensitizing mutations. A larger tumor DNA sequencing panel would identify these, but the small panels that are used in standard of care typically don't. And a lot of these desensitizing mutations are targetable. So make sure you use a large panel, make sure all of the data that's gathered is utilized and not just the top options, and make sure you're checking for desensitizing mutations, and you should have the best possible benefit from your targeted therapy.